The fourth Emmy Award-winning procedure is going to be live March 14th here on AZTV 7, and I talked with Dr. Rizik about what we're going to be doing for this procedure. Well, Doc, I see where you brought me to talk today.
You notice someone from Michigan burning somebody from Notre Dame on that picture.
Oh my goodness. I am so glad we come together to do a procedure not during the football season.
That would
not be good. Let's talk about this procedure because, we talked about how the other ones we did for elderly people. Now we're moving into younger people. But what's very interesting, this is a disease that actually you're going to repair with this item right here.
That's right. This is called an Amplatzer PFO occluder or PFO closure device. Now, unlike the previous procedure, the previous procedures we've seen, these are elderly patients who developed the disease, coronary disease or valve disease, as they got older. Now we're moving, as you said, into a younger population, and we're going to be treating a disease that young individuals were born with, so-called a congenital heart abnormality. They didn't know they had this. They didn't know that they were born with it, and it usually comes to light or is diagnosed when they're in their 30s or 40s when they have a stroke.
Wow. And so what we're going to be doing in the operating room now is actually closing a hole. And this is going to be very interesting, but it doesn't take that long to close this hole, but it prolongs life for a long time.
That's absolutely true. So a PFO, or a patent foramen ovale, is a hole that is necessary for a developing infant when inside the mother's womb. Once you're born, as time goes on, that hole is going to close, and it's going to close pretty much automatically. But about 1 in 5 adults has sort of an incompletely closed hole. So there's still a potential hole there. And if you develop a clot, for instance, in your lower extremities, that clot can go up to the heart, cross through that hole, and go to the brain. So closing that hole with a PFO closure device is extremely important.
Okay, what should someone ask their doctor about if they might think they have a hole, or how can they find out they have one?
Well, you have really stressed so much over the time course that you and I have been together about women in medicine. This affects women more commonly than it affects men. If you look at the science and the studies that have been done, women have PFO closures more frequently than men. And the way it comes to the doctor's attention is a young individual will have a stroke. Anyone under 50 or 60 years of age who has a stroke, you should at least be thinking that maybe they have this residual hole, this PFO, and you can do an ultrasound, a very easy study to determine if a patient has that. But any young person who has a stroke, you should be thinking about a PFO.
Yeah, and let's remind them, it's not like a major stroke that we think about. It's the small ones, because people don't realize, like, that could be someone losing their speech for a few minutes or losing their balance or anything. Those are strokes in a way.
Those are still
strikes that we need to pay attention to.
Those are still strokes. The thing about strokes due to a PFO, most of them, fortunately, are not catastrophic strokes, but we see patients every year who do have very large, very severe strokes and are left disabled for a lifetime. So that's why it's very important, if someone is having neurologic symptoms, to get, especially if you're a young person, to get to the doctor and have this investigated.
All right, well, I'm looking forward to us going in March 14th back into the operating room for another award-winning procedure.
I'm hearing the buzz that Brad Perry is back in the building.
I'm looking forward to it. Dr. Fitz.
Thank you.